We welcome you all to Talk the Talk. My name is Janine Stiene,
And I'm Toni-Ann Antoniato.
the Masters of Myofunctional Therapy.
Together, we interview physicians, dentists, and other professionals to learn how their expertise can benefit you, your child, or your patient's speech and language skills and complement the services they are receiving. We welcome Dr. Catherine Murphy, also known as the Holistic Orthodontist, to this episode of Talk the Talk. Dr. Murphy is an orthodontist, author, mom, and holistic healthcare advocate. Thank you so much for joining us today.
Thank you.
Oh, well, thank you. I'm looking forward to, really being able to share with your followers and, provide them some information that maybe they haven't heard before. So thank you.
Excellent.
We know that you are an orthodontist by trade, but can you tell us a little bit about you and what has shaped your career into this holistic orthodontic avenue?
I would love to. So actually, this story goes all the way back to childhood, honestly, because the universe just keeps giving you the same lesson until you actually learn it or embody it. And so in my case, things started fascinating me at a younger age, but then I never really jumped in, right? I had all these different opportunities. Looking back, I even had one of those big Borders books. I think I'm a lot older than both of you. So maybe you don't remember when they used to have those big, huge, 12-inch big books right by the door, right? And they were ridiculously inexpensive, like $5, right? And I bought one right after high school that was natural remedies. And in it talked about Rolfing, craniosacral therapy, massage. Well, it was kind of a lot for me, but I really took to the face massage, which now, how many years later?
So now the math comes, right?
So we're just gonna, I don't know. I'm not embarrassed. I'm 44. So you can do the math of high school, right after. And I was giving my friends these face massages. And now here I am doing my, Take 3 from Me self-care movement, which embodies the face yoga, but also myofunctional therapy. And it all goes back to the face massage that I used to do and relax everyone in 10 minutes or less, just giving face massages. So it goes all the way back to the many different opportunities I could have really delved into the holistic approach to health. But I also grew up with very traditional sided views. My father is also an orthodontist.
Okay.
And his father was a dentist. I didn't get to meet him. He passed away. And so we have other dentists in the family and professionals in the healthcare field. So I was very much that's what was around me. And then I had opportunities again in college. In fact, I had someone, she was so excited to learn that I was a dentist. So it was after college, and talked to me all about how fluoride, I should really limit my fluoride. I'm like, what is she talking about? No, I am from Indiana University, which is the home of Crest. And now here I am yeah, there are other options. And yes, now we can reconsider a lot of our fluoride use.
Absolutely. Yep. Wow.
Yeah.
So that's how it all began.
And then it was my son that really, once he was born, I finally, I dove in. And does anyone have either of you ever gone skydiving?
Yes. Yep.
No.
Incredible, right?
Yep. Incredible.
And you would do it again.
Yep.
Well, I compared to skydiving because as soon as I got down on the ground, I'm like, can I do that again?
Yeah.
And I went back up. And I'm like, why didn't I do this sooner? In my life, why did I wait? I was 20, I don't know, in my 20s. I'm like, I should have done this earlier. And I think that I should have delved into the holistic approach a lot sooner, but here I am.
Wow. How would you say the holistic ortho differs from traditional ortho? And do you find that you get some opposition from some, or has that changed over the years?
Well, I think both of you would agree, if you're not getting opposition for something that is on the leading edge, then you're not on the leading edge.
Mhm.
And we're here because we want your followers and listeners to really understand that everything that's on the leading edge is really where we can get out of our norms and really make the difference in our lives, right?
Yep.
So the traditional approach to the holistic approach, there's many different things. The number one difference is viewing the crooked teeth differently. So the crooked teeth are really a symptom of underlying causes, and they're not the problem to fix.
Yep.
And it takes a lot of unthinking, especially for those that have gone through the orthodontic residency. I find it's easier sometimes for those that are maybe in a different dental specialty or practice general dentistry to look at that, because we are so trained to have the perfect smile, right?
Mhm.
However, now I'm at the approach where if everything else is functioning better, but the teeth are not perfect, it's okay. It's still hard,
Yes.
right?
Mhm.
But it's okay. There's a lot more important things than just the straight teeth.
Mhm.
Other things is really when to start. There's many different reasons, and a whole hour could be spent on why traditional orthodontists start maybe at 6, but really that's not, most of them don't prefer to start at 6, and they don't prefer to do phase 1 treatment. So usually it's more around 10 to 12
Okay.
versus the holistic approach. When the youngest patient I've ever seen was 2 weeks old.
Wow.
I'm not going to be putting brackets
No, no, on the gum?
2-week-old.
On the chung?
Yeah. However, really our specialty is all about growth and development, and somehow that got lost. So we should be we're the growth and development of the jaws, but then really the public has demanded that we just do it faster with less involvement. So the pushback is not only from other professionals, the pushback is also from families that want to be able to be like, here's my kid's mouth. I'm going to drop it off for a half hour. I'm going to pick it back up, and I don't want to do anything else at home because their plates are already full.
Yes.
So, but going a little bit more forward with the differences. Also, I mean, I was taught you have to wear your retainers for the rest of your life.
Yep.
And if you don't, the teeth will move because of the lack of retainers. Instead of, okay, well, what's supposed to help keep things together? Now, granted, I'm not going to expect with my different outlook that things are going to be exactly the same as when you got them off at whatever age, because we adapt. But also for the rest of your life, number one, that's just an impossible thing, right?
Mhm.
If any of us could dedicate one thing to do for the rest of our lives, I would just ask everyone to just breathe through their nose for the rest of their lives, and our problems would be solved, right? But if we can get everything to work in harmony together, then we won't see those major shifts. You might see a little bit, like if you look closely, number 23 has drifted a little bit, even though I've got my tongue tie released, I've got everything up to the roof of the mouth. But I'm still living in the modern world, and I'm still not walking my 10 miles a day. But that's going to be okay. A little shifting recognizes to me, I got to get my life back in harmony.
Yep.
So rather than saying wear a piece of plastic in your mouth the rest of your life, let's have your tongue up to the roof of the mouth for the rest of your life and use that as your retainer.
Right.
Another thing that gets me, and I think the reason why it really gets me is because I can just envision this mom asking me about this question, and it's teeth grinding.
Mhm.
Traditional orthodontists would say, oh, well, that's because you're in transitional dentition from having baby teeth to having adult teeth wanting to come in, and the kid will grow out of it. Or it's stress.
Yep. Mhm.
And it's
Gotta
like, well,
feel the emotional piece first, right? Mhm.
and what parent wants to hear, oh, my young kid is so stressed they're grinding their teeth? Or just go home and bear with that horrible sound
Yeah.
until they grow out of it.
Yep.
Neither one leaves that caregiver feeling that they've been heard, empowered to help their child. Instead, now they really don't want to walk past that bedroom at night because they don't want to hear that sound, which separates them from their child on so many different levels.
Definitely.
Additionally, then in adults, we would view that bruxism again just as stress, put the night guard in, instead of getting to the underlying cause of why that person is clenching, grinding during the day.
Mhm.
And traditionally, if we could just take the tongue out of the mouth, put the brackets on, put the tongue back in, that's
Yep.
what we would have done.
Yep.
So traditionally, anything that was going on in the mouth around the teeth wasn't looked at very much.
Mhm.
A little bit, I will say a little bit, because we did talk about ankyloglossia, tongue tie, but we talked more about if it was right at the tip.
Yep.
We talked about lip ties, if they had spacing.
Mhm.
So the discussion was there, but we didn't take it that next step.
Mhm.
We would we would talk about different appliances and catching on the buckle ties,
Yep.
but we didn't talk about why those buckle ties were too low. Versus
Mhm.
the holistic approach is, if we're seeing tension in the mouth, let's look at what we can do to help relieve this tension. Let's see why, and work with myofunctional therapists to get to that root cause. And in some cases, you don't need to actually release the tension. You just need the muscles to work better.
Absolutely.
Yeah.
And have you seen it change for a positive in the last few years, more towards people wanting that holistic approach? I just feel from a myofunctional therapy standpoint, the last 5 to 7 years, there's really been an increased awareness, an increased education, and an increased desire to go that route. So I didn't know, as a holistic dentist, do you feel like you're seeing that as well?
I am so happy. I'm seeing so much more interest, number one, where they will, and when I say they, anywhere from families to grandparents to other professionals will listen. So that's a big step, because I used to just get that blank look like, like she's talking about the tongue again.
Yep. Yeah, how does one have to do with the other? I'm talking about teeth.
Or you're an orthodontist, why in the world do you care about infants?
Right. Yeah.
To then all the way to the other spectrum, where they're interested, but they still want me to be able to do it in the same fast, very systemized approach, where it doesn't take more of them at home.
Okay.
So I am loving the more interest. I am recognizing that our behavior, it is just that, right? Because we can only take on so much. So I get to also then shift to, how can I do this where I'm really talking about it in a way it's not adding more to the household. It's actually going to help in the long run take a bunch of burden away. But how can I do this in a way that they really see that? Because when you're already so stressed, and there's like, kids' schedules now are crazy.
Insane. Yep.
And my kids are only 3 and 6. So I'm like, oh my goodness.
Oh, it's gonna get worse. It's gonna get worse.
You're almost there.
You're almost at that point where, yes.
We hope that they don't have any interest in travel ball.
Exactly. Toni-Ann just started that. I'm on that tail end of that. Yep. Yep.
So how can we incorporate this so it can make your travel ball experience better? How can you do these things to then see that this is going to improve many different facets of your life? So it's a really interesting time, because now I've done this for long enough to see this, but also short enough to be like, oh man, I really thought this was going to be just rainbows and butterflies, right? And that's why it's coming back from when my father took courses in the 1970s on myofunctional therapy. I have a book right here that, if we have a chance, I'll get up and get it.
Is
I
it
should have gotten it out
Garliner?
earlier. Is it
Is
who?
it Garliner? Daniel Garliner's book?
I think it might be.
Yeah, I've read it multiple times.
Oh, okay.
Very
And it's
antiquated, but yes.
But it's amazing, but there just wasn't that connection. And I don't think there was that drive of different professionals to take on myofunctional therapy on top of what they were already doing.
Agreed.
Yeah.
Agreed.
Absolutely. I feel like we obviously can appreciate that as the myofunctional therapist, because we're in that situation too, where we have the families and they come to us and they have these crazy schedules between sports and school. And now it's like, okay, well, this is a commitment. This is something that takes time, and it takes practice, and it takes, that motivation to be doing it and finding a way to make that balance in their life.
Yes, we don't have the magic pill, even though we want to. If we did, we'd be very, very successful and wealthy, but we don't have that magic pill.
I have a wand that I was going to grab. I have a wand it was my consult room. And I'd be like, if I had a magic wand, trust me, I would use it on you. I would have people lined up. I'd come back from Hawaii. I'd work once a month, and I would just cure everyone. It would be amazing.
We need a wand.
Yes.
We need a
We
wand.
want the magic pill. We want the magic wand.
I like it. I like it.
Because
Yeah.
then you could just be like this, and I just envision myself being like the fairy godmother.
Yes. Maybe
And
we should
here
get
is your
with
home.
him.
That's funny. So we also know that you are an author. You wrote a book. I wrote a book called Dear Mama, and I own it. And I find, as a mother and as a certified lactation counselor, that it is so sweet of a book. Can you tell us a little bit of what inspired that route for you?
Well, thank you. And thank you for supporting the book, because it's really like my third child. When the whole creative thing came to me, it was actually during the pandemic, where I needed an outlet. And really, I wrote it on my phone.
No way.
And so, because all the stuff I needed an outlet. And I think being home and having to take away time from my practice, I was like, oh my goodness, this story that I have about my son, and it's really about the struggle of that first year. I had a hard time nursing. He was failing to thrive, and I was told, you're a geriatric mom who worries too much. Just go home and enjoy your child.
Oh my gosh.
That's has to
And
make you feel great, right?
oh yeah, I just skipped out of there.
Yes. That's horrible.
And I had waited a long time to be a mom. I had wanted to be a mom. And so I wanted to go home. I wanted to enjoy my child. And when I was asked by a local nonprofit that really wants to help skip the whole pain of decay in kids, called South Shore Skipping Stones, they asked me to speak to these moms about my breastfeeding struggles. And I said, well, okay, great. Like I had no idea it would be so hard. My mom just told me I latched on, no problem. And I asked, so why me though? And they said, well, if it can happen to a doctor, it can happen to anyone.
Yep.
You didn't get the support. And this is a colleague. I mean, she's the wife of an orthodontist in this area. And I'm like, okay. And then the more I would share, the more people shared their stories with me. And I'm like, oh my goodness, there's so many women out there thinking it was their fault. They couldn't nurse. Because even with me, they looked at me and said, well, you this, and didn't look at my child. When I went back, his head was tilted the same way in every picture, because they took a picture at the pediatrician's office every time we went in that first month. And when he didn't gain weight, all I was told was given this bottle of formula, and you can't leave till he drinks it all. So that's when I stepped in and I'm like, you know what? I spent so much of my life shoulding myself. Like, I should do this. I should do this. I'm like, I'm not going to should my son. And it came up. I mean, people are still, you should just follow what the doctor says. You should just do this. I'm like, well, I am not going to should him. And it was late night scrolling. So the avatar in there where my favorite pictures where the mom is on the bed scrolling. I'm like, I'm trying in one picture to represent all those nights of those moms that I reached out to and knew they were doing the same thing. They're trying to learn about tongue ties and everything through Dr. Google, because the doctors I was with didn't know. And it was when she told me that, yes, I will write you the referral for physical therapy, but it won't help. because she had missed the torticollis. The #1 hospital in Chicago had missed my son's torticollis. And they told me it wouldn't help, yet he was always like this. And when you look back at the pictures, you can see it. But I was an exhausted new mom. And I had to get over that self-blame. And I wanted to just let more moms know that you are not alone. You see it in your child. You can feel it. You might not know what's wrong, but you feel it. And let's find where you can go. Let's find your tribe. Let's find those providers. You just really need one. You just need one to help you and to keep reminding you that as the mom, your input matters. So that's why I wrote it. That's what it's all about. It's about that journey. And I mean, anyone who writes a book will tell you that it's a cleansing for them, and it's a cleansing for me to release a lot of that shame and pain that I put on myself for not doing things differently from the beginning, for not asking the questions from the beginning. But I didn't know.
Right.
And we have to just start asking and feeling okay with asking too.
And your book definitely helps other moms feel that way and know that they can trust that gut instinct that they have as the mother.
I think there's always the
Thank you.
assumption if you're a doctor or a dentist or, have some side of medical degree that you know it all in all aspects of everything. And, I always say, I know, the speech, I know myofunctional therapy, but don't ask me other things, I think it's just that assumption that makes it more challenging because you're almost not getting the support you need and deserve as if you were the general layperson that was coming in with the same needs, questions, concerns, problems. But I also think it's a lack of understanding and education on those providers' behalf also. I know for us, myofunctional therapy was never taught in school. Tongue thrust was never taught in school. I didn't know about it until I, started getting involved in the therapy, but it's amazing what I've learned from it and the impact that it's had on my life and our patients' lives. And now seeing more and more dental and medical providers understanding it, it's like enlightening because you're like, okay, I'm not preaching to the choir. I'm not, having this conversation with the wall. Everybody's finally starting to get it. And I think your book really does that. It does give that comfort for those families that are going through the same thing. And especially as a dental provider, I think that gives them a little more hope, I think, or a little more understanding. Wouldn't you say?
Definitely.
Well, thanks. I'm hoping, I was hoping Dear Friend would be out by now, but we've run into hiccups. But Dear Friend is actually for those families that they didn't see it as an infant, but yet their child now is 6 and hearing the snoring, the messy eating, the always tired. So it's from the kid's point of view, it's actually how he goes from being really just like what our patients are, right? Tired, not knowing that you could actually wake up feeling good every day, being very picky eating, having lots of cavities, to then finding that provider that says, oh, you know what, we can actually get started on this now. And so it's his little journey through a picture book of going through and actually having the myofunctional therapy, the releases, other therapies, and then being happy that he's no longer snoring like his grandpa.
Oh, we definitely
we will have those. They will be in our office.
I will send it to you.
Trading. I love it. I love it. So we do follow you on Instagram and
Thank you.
love all of the educational posts, especially about mouth breathing and how important nasal breathing is and how imperative it is for just growth, development, health, wealth. Tell us about how you saw mouth breathing as a negative impact with your patients and their dentition.
Oh, well, where to start with that? Once I really was able to take off the glasses that mouth breathing could only occur in patients that looked, the term adenoid facies. Is that a term that you guys also use in speech? Okay.
Yes.
But some of those looked really extreme, right?
Yep.
And you're like, well, goodness, a lot of times they would have so many other conditions too that you could put off. Well, no, they look like that for this, this, and this. Instead of relating, oh, well, they have this, this, and this because of the mouth breathing, right? So once I could switch that and realize that, number one, you could be mouth breathing and not necessarily look like that, because where your mouth breathing had started, at what point of development, and relating all the symptoms that adenoid fasces would have with it. And then I saw it everywhere.
Yeah.
I'm like, oh goodness.
Sometimes it's better not to know, because then you see exactly. I'm always diagnosing,
There's
always.
no turning back.
No turning
Yes.
back. Mm-mm. Nope.
So then it's in every patient. I mean, there's a whole range, right? Because some may just mouth breathe while they're sleeping. Some may mouth breathe while they're talking. That is one aspect, as you can probably hear, that I still get to work on. I've also, though, chosen, I'm still very narrow,
Okay.
but so it's a, it's a habit that I can work out of, and I'm still just not quite there. So sometimes they may just mouth breathe while they're talking, but they're talking a lot, then you're working the whole facial system around that, and the teeth are going to adapt. So now really the top priority with my patients is, if they don't know that they can use their nose and trust their nose, I don't even really want to get started on them,
Mhm.
because I'm going to just be rearranging things for them to fall back. Or I would then fall back to the, you have to wear your retainers, and then the retainers are taking up space for their tongue, or they're crossing the midlines with a rigid structure if you do the bonded ones.
Mhm.
So now nasal breathing is key, but it's also not just key for the teeth. What I've also found is that these patients with the crooked teeth, with coming in once they get to my office, if they're mouth breathing, they're working so hard just to breathe. And then they don't really get to thrive. They might be thriving in many other ways, but they have to work so hard at it. And life doesn't have to be such a struggle with things. So I talk to them about I have two different triads. My triad of breathe, sleep, eat. Those three things can, positively affect each other or negatively, but your body is going to do everything it can to compensate to breathe how you need to breathe. So if you can't breathe properly, it's going to compensate to that. If you're not breathing properly, your sleep is not going to be great and restorative. If your sleep isn't great and restorative, what you choose to eat is going to be impacted. You're going to be looking for those simple carbs that will give you those energies, or you're going to look for that coffee if you're an adult. So if we can positively affect things, we can get that triad to be better, because sometimes you have to start at what they are eating, because if that's causing more inflammation, then it's going to just make that change in breathing almost impossible, right? So we have to start somewhere. Sometimes it's going to be different with different situations, but the goal is always to just nasal breathe. My other triad is that 3 systems always have to be looked at with braces: the skeletal system, the bones, the muscular system, and the nervous system. And so the pairing of orthodontics with myofunctional therapy, in my opinion, they go together like peanut butter and jelly.
I always
The
say
nerve-
exactly what I always say: peanut butter and jelly.
Yes.
I like it.
But the nervous system, that one is going to be really different for different patients. And even the muscular system, because a lot of those healthcare professionals with the nervous system I refer to will also help with the muscular system, such as craniosacral therapy, chiropractic care, occupational therapy, right? And then, of course, speech therapy. Since I'm talking to 2 that are speech therapists, sometimes I have to separate that out, right? Because we have dental hygienists being the myofunctional therapists. But I'm like, you have to look at those 3, because if we only focus on the skeletal and the muscular, and we don't actually have the nervous system so that it can all relate, which is something your specialty is beautiful at doing, because you incorporate that already into your work. But that's not always part of every myofunctional therapy's work. And then it's important for people to know, because the training is just different. But you need that communication to be worked on. Otherwise, you're not going to get the results that you're looking for. And being with a holistic approach, these kids come from sometimes some trauma that they didn't even realize they had, going all the way back to birth trauma. So things like the cranial psychotherapy can help with that trauma that's stored at that fascial layer. It's really been eye-opening to talk with professionals that experience, that can help with that birth trauma, because birth is traumatic for the child. And in dentistry, we recognize this with the neonatal line. Are you guys familiar with the neonatal line?
No.
Where if you look really closely, you can see a slight line in the development of the dentition during birth, because everything stops to give all energy to the baby for birth. And I'm like, gosh, I learned this, but I didn't really equate just how traumatic it is for a child. I mean, they have to go through it. There's so many with the sutures to go through it, but then to help get them so they can move properly right after, instead of, bunching them together so they can't move their bodies. It's been fascinating for me as an orthodontist to be able to learn that and then actually see. So now when I look at a patient, they have a lot of asymmetries, I will ask them, like, so tell me a little bit more about the birth. And oftentimes they either had to vacuum, the forceps, they had difficulty, and it was an emergency C-section because the baby just couldn't get through. I'm like, okay, so now we know a little bit more about that trauma. And it's been fascinating because now a lot of my questions can get answered.
Do you ever find that you're coming up against opposition from other medical professionals, such as the ENT, if you're noticing that adenoid facies and it's enlarged tonsils and adenoids that are causing the issue? And are you ever seeing that opposition? We see that a lot, or make the recommendations for what we see, but we're not getting the support on that side to address those issues.
Yes.
Okay.
And how I have kind of helped around that is, number one, I've worked really hard at getting a good community. It's hard to find an ear, nose, and throat doctor, which I understand, because number one, they only have so much time to be training on things that don't involve cutting, right? Because we have our duties to then fulfill for our patients, and that's also then what pays the bills.
Right.
So I get that. But also how we approach it now with patients, our beam readers report really helps back us up. So each patient, they get an ICAT, then we send it to radiologists to read it. And their reports are beautiful, because then they will write in there, oh, and this patient is at this airway volume, which puts them at risk for sleep disorder breathing or obstructive sleep apnea.
Okay.
And so it's not me,
Okay.
this holistic orthodontist
Yes, exactly.
saying it. It's like, oh, here's the airway volume that is indicative for those that will then have trouble with their sleep. Please view this child for their tonsils and adenoids.
Okay.
And what's also been easier, before I didn't have a myofunctional therapist near me. The closest one was an hour and a half away, and she's fantastic. If you know Lori Fry, do you guys know of Lori Fry?
I don't know.
She's been doing this for almost 30 years now, but it was an hour and a half away and a time change. So it was really limiting for patients.
Okay. Yep.
And you'd send to ear, nose, and throat, but they'd still be breathing through their mouth. And their ENT would be like, I did my job. I'm like, well, yeah, you did, but they're still breathing through their mouth. What am I supposed to do? But now I feel very well prepared that if they need that obstruction taken away, they can go, the obstruction can be removed. The myofunctional therapist is with them before and after to help rehabilitate that breathing. So I feel much better that they don't really have to be involved more than just removing an obstruction.
Okay.
Absolutely.
That's great.
Do you find that, or in your opinion, do you feel that all orthodontists are looking for restricted airway and nasal breathing, or is that not something that tends to be in that more traditional ortho approach?
Well,
the diplomatic way. Yes, I get it.
well, it's not even a diplomatic way that I'm going to answer this. As you both just mentioned, that once you take your blinders off, once you see what you see, you can't unsee it. And I very much understand that there are a lot of people out there that want the very systemized approach to orthodontics. And those that are providing that are doing it very well. They're providing systems. The parents know exactly how long, et cetera, right? That's what those families want. If that practitioner starts to look, he or she then can't unsee it, and it unravels everything.
Okay.
So I feel that those that really don't think that they can change the way they are doing their profession, no matter what, they just can't, we talk about there's only so much that you can do in life, right? And if they're not feeling called to change that, then you do your thing, and they're doing it. And I support, because they're taking care of that population that wants just that done.
Mhm.
The problem is to then say it doesn't exist, or that other people are doing things they shouldn't do because they are viewing it differently. That is where the profession is having some mixed feelings, because you take care of one population, I'm going to take care of those that want the life enhancing treatments rather than short-term solutions. Not everyone wants me. That's okay. Not everyone wants a systemized approach. But those that don't see it, as you said, once they do see it, they can't. And they might just not be able to handle that, depending on where they are with their career. We all know that once you know more, you can do more. And some they just can't know more right now. So that's not being diplomatic. That's just being really honest about where
Yes.
people are with their profession. And I very much speak up for those that say, oh, well, they took out 4 teeth and they ruined my airway. I'm like, they took out 4 teeth. Yes, they did what was asked of them. They straightened things up. But by the time they took out the 4 teeth on you, how many other professionals missed that?
Mhm. Right.
That should have been found. And that's part of Dear Mamas, because if I hadn't taken that dive in, he would have been that kid that, oh my goodness, was missed. And we just kept treating the short-term solutions. And then I'd be getting him into an expander right now.
Mhm. Right.
So as much as I would like to say, oh yeah, like let's never take 4 teeth out, it'll never get done. Oh, those people, no, my goodness, so much was missed before you could even take out permanent teeth. By the time all the permanent teeth are in and you're taking permanent teeth out, it was missed. It was missed. That caregiver wasn't honored when they had questions. That caregiver, when they were like taking their child, why do they keep getting all these cavities? They're not eating sugar. No one took the time to talk to them. If you're mouth breathing, it doesn't matter what you eat. You're going to be more prone to having cavities.
Yep.
So yes, I am often ostracized in my profession, but I will stick up for the profession as well, because what people ask of their professionals is what they will give them. So let's empower those caregivers to ask for more.
How do you teach the caregivers to identify mouth breathing, something more of a habit versus a reliance on it for, to build their airway, to have that airway support?
Well, I kind of take the approach of, like I look at the kid and I imagine how the child might be at home. And so I'm like, oh, and this is a common one. Does your child like be really messy when he or she eats, or like, oh my gosh, yes. And like, okay, so you start with what they already notice.
Okay.
And sometimes they might already present that to me. At this point, every dentist that sees kids should be having a sleep questionnaire. There's no set questionnaire that they have to ask. They just have to screen for sleep disorder breathing. So at that point, they should have something. They should have something to talk about, like, oh my goodness. So that's a sign of mouth breathing, and you need someone else's help. Because if they're not trained, just know when to refer. So then when they get to someone like me, they fill out a more detailed sleep questionnaire. I have an observation sheet for them to look at and be like, oh goodness. And hopefully they'll get that before their appointment with me so they can start taking a look at things. One, I have just putting things in their mouth. They might just think that's a habit, like, no, do they just always have to have something in there? How often are their lips apart? Is it noisy breathing? Like, can you hear your child if they fall asleep in the backseat of the car? Can you hear them? Do they fall asleep while watching TV? All kinds of different things. Oh, if there's drool on their pillow, such things that they might not be equating to mouth breathing because it's just an annoying habit.
Yes.
And so the list breaks it all down from what they might be getting in school to in front of the TV to while they're eating.
Right. We have a very thorough case history as well that we go through with our patients. And a lot of the times the parent is like, oh, you asked that question. I had no idea it could even relate. And then explaining, how it does all relate and how it does give us pieces to the puzzle when we're trying to determine the best treatment plan.
That's great.
Yeah, I think there's a sense of relief, like you're explaining, like, oh my God, it's not a behavior. It's not something I'm doing wrong. It's not something that my child's being obstinate with. It's because there's an actual underlying cause.
Symptom of something greater.
Yes, absolutely.
So I know that we could probably talk forever about the benefits of nasal breathing, but for the listeners and maybe for the parents that are listening, what are some of what you feel are the major benefits of why every child, every adult should be breathing through their nose?
Well, the number one thing, I'm not going to actually relate it to what some might think an orthodontist would say. My number one benefit of nasal breathing is that you are so much more calm. You are so much more yourself. In our world, there are so many stressors trying to make us be doing 5 things at once. We're getting information all over the place. Our kids now are getting things thrown at them at such a fast speed. If they can be calm with their breath, they're more in tune to themselves, and all that other static noise around them can just be around them and not within them. So that's the number one, because my number one goal is for all of us to be able to thrive as people. And part of thriving is really being able to be more in tune to ourselves. Then, of course, the growth and development. Really being able to have our tongue up, breathing through our nose is going to help us grow and develop into the proper structure that we should. And I say that because oftentimes patients will be like, oh, well, so-and-so just looks like the grandmother, looks like this. But that doesn't mean they're destined to have to look like that. When we nasal breathe, we can feel good every day. When we feel good every day, we are going to grow and thrive to who we are supposed to be, not only with our facial development, but with our intellect, with everything. And that it's so much more of a challenge when you're mouth breathing. Your whole body has to work so much harder. Because again, the trilogy of breathe, sleep, eat, your body will work. So it will do everything because we're all breathing. We're all right here. So that's the 2 benefits. Number one, being calm and more in tune with yourself, and then growth and development.
Absolutely.
How often would you say you're referring patients for lingual and labial frenectomies, providing or recommending palate expansion, different ways to give them more success with regards to their ability to breathe and regulate themselves the way they need to?
So I'm very fortunate with both practices I work at. There's myofunctional therapy right there in the practice. So with that, then they are being evaluated for the tethered oral tissues, the restrictions by me. I communicate that with the myofunctional therapist. They go through the myofunctional therapy, we communicate during it. And then all of them are also then looked at by the specialist that would actually do the removal, the frenuloplasties, et cetera. So So whether or not that's a full frenuloplasty or just the frenectomy with only using the laser versus the full functional, because that's also where it depends on what that patient can handle as well, because some patients can't handle the full functional frenuloplasty, but they can handle a less than 30-second laser frenectomy. So each patient of mine will go through that, unless of course they refuse, which you talk them through, and you can only do so much.
Yep.
So I
Exactly.
really benefit from that. And as far as expansion, it's one of those funny things, because other practitioners will say, oh, well, if you see Kathy, you're going to get an expander. I'm like, well, but also if you go to a heart surgeon because you have heart conditions, they're going to be looking at your heart.
Oh, yes, exactly. Yep. Yep. Exactly.
So yes, most of my patients will need an expander. I still get an occasional few where they actually have fine intermolar width and they don't need an expander. They really just need to actually have everything work in harmony better together. And the missing piece really was the myofunctional therapy. And then I can just rearrange things a little bit. But that's rare, because why would they come to a specialist if, so I'm seeing the more severe cases. And so in that case, they're having the low tongue posture, they're having the narrow palate, and we put an expander in. But also sometimes we need the expander to help with the protraction, with the advancement this way, and not just so back and forth, not just sideways, for those that can't see me.
What ages would you say are the youngest ages that you're looking for being able to expand?
Right now, where we are with our entire team at both offices, the youngest right now we have is 4. But typically around 5, 6. It's wonderful. We have a colleague, Dr. Kevin Boyd, who's in Chicago, so about an hour and a half away from here, who will see those real littles. For the real littles around here that then can't get up to Chicago, I love the Myomunchie. Do you guys use the Myomunchie? Okay,
Yeah.
love the Myomunchie to just help really use the tongue as the expander for those littles. And my daughter started at about 2 with hers to help just retrain that tongue for the proper posture and using the tongue as the expander.
In terms of those littles, speaking of, is your preference to have the tongue in the proper position as early as possible so that they're supporting that natural growth and development? And is that what your ultimate goal would be if you could write that picture perfect model?
Oh, yes. I mean, it's all about the tongue will help direct that growth. And if the tongue is up at the roof of the mouth, then you are setting your child up for success.
Absolutely. Okay, so I think one other area we wanted to touch on with you is that you have spoken in the past about mouth taping. And that is something that sometimes we get a little controversy on. And we are very specific in terms of why we feel a patient could benefit from mouth taping and the right type of patient that could benefit from mouth taping, because it is not for everybody. What do you find are the benefits of mouth taping, and when do you recommend it?
Well, so I will start. I very much support that. Yes, it is not for everyone, especially those that have had any type of trauma. Now, it doesn't have to be a trauma that necessarily involved their face, but there are just some traumatic instances that they don't respond well. Okay. So there's no one thing that you can say to everyone to use as a health adjunct that's going to work for everyone. But for those that it works for, it is fantastic. Number one, I love Patrick McCune's MyoTape. I love it. I was so blessed that Patrick was speaking at the AAPMD and my son was coming with my husband and daughter to pick me up from it. And I'm like, my Patrick, because my son's name is Patrick. I'm like, do you want to meet Patrick McCune, who invented the MyoTape? He's like, sure. And so I love it for the exact reason why they show it on the cover here, that kids can wear it during the day. And it supports, number one, the child knowing, okay, my lips can go back together. They can still talk with it. They can still eat with it. the parents don't have to keep reminding lips together, right? Because I would do that to my kids, like lips together. Instead, the Myo tapes around. And what really astonishes parents is because if you're going to prescribe something like this, you're going to have the parents do it too. And they might use something different. Like the parents go ahead and actually have the tape over their lip. And then like, oh, shoot. Well, that is crazy. I didn't realize what a change I would feel in my body, what a change I feel in my nose when I'm actually focusing on using it. So it brings the parent, the caregiver into this co-treatment, which I think is key for everything. And now, I mean, there's so many options that then I like the parents to do it first. So really when I talk about mouth taping, I'm directing it to adults first, because adults really sometimes don't buy into that they are doing it too, that they are also mouth breathing. So Somnifix has been around for ages. Drift is so cute with the lip shape. I love all these options. I use this option the most though. So they can really feel it for themselves and then understand why they're putting their child through myofunctional therapy. And they can start embody, I'm doing this for my kid instead of to my kid. And if they can feel better, which is the whole reason why I co-created that Take 3 for me, was because I'm like, okay, so how can I get these parents to understand these exercises? Oh, shoot, if I put it with how they'll look better with it, because really a lot of face yoga, it's just myofunctional therapy exercises directed towards looking better instead of functioning better. And if I can get someone to calm down and take 3 deep breaths and they can feel the change with 3 breaths, oh shoot, their child is going to just thrive because their child is being trained to do this all the time.
Okay.
So that's why I love it. And my videos, I understand it's controversial, not for everyone, but for the majority of people that can like do this, it's life changing. And it has made me go from being groggy every morning and 5 cups of coffee to where I don't drink coffee.
I'm working on that with my husband. It's been quite the battle, but we're working.
Oh, husbands are the hardest.
Smother him with the pillow, so it's nasal breathing or the pillow. So he's opting for A. No, it was
Smart man.
It was such a pleasure speaking with you. We try to spend a lot of time doing some education to the same extent that you are. And it's always nice to find someone else that is like-minded and understands the importance of myofunctional therapy and the tongue, and it's eye-opening when you explain it to people. And now I think more than ever there's just a lot more people willing to understand it and accept it. So it was just really wonderful having you on today, so we really appreciate that.
Yes.
Well, thank you. It was such a pleasure. I really hope that your followers got something from this and they can reach out to me, and I'm passionate about this, so I love to help. So thank you so much. And I just keep doing what you guys are doing, because I love that you guys just opened up another office, right?
Yeah.
So that's incredible. I love it. So keep just doing your work and helping these littles and adults and changing the world.
Thank you for joining us on this episode of Talk the Talk.
We hope it was enjoyable and educational and further supports you both personally and professionally.
For more information, please check out our Myo and Myo Minute podcast, as well as our other episodes of Talk the Talk.
And stay tuned for more information about our newest venture, the Spot Pal, a tongue training appliance.